Welcome everyone to the latest installment of the Research into Action webinar series. I'm Nicole Elguero, an analyst on CADCA's evaluation and research team. The purpose of this webinar series is to introduce coalition members and substance misuse preventionists to current and relevant research being conducted in the substance use and community coalition fields. In today's webinar, we're honored to have Dr. Adrian Bravo join us for a presentation on his recent research article, Changes in Mental Health Symptoms as a Predictor of Cannabis Coping Motives and Consequences, examining the impact of COVID-19 among college students, published in Cannabis in November of 2023. Adrian J. Bravo, PhD, is an assistant professor in the Department of Psychological Sciences at the College of William and Mary. He has a PhD in applied experimental psychology from Old Dominion University. His research interests focus on identifying who is most susceptible to the development of substance use and mental health disorders, under what conditions individuals engage in health risk behaviors that lead to poor mental health outcomes, and problematic substance use, and what factors may decouple specifically mindfulness, the relation between health risk factors and health outcomes across distinct populations like college students, clinical populations, and military personnel. He's a founder and principal investigator of the Cross-Cultural Addiction Study Team, CAST, a collective of international scientists consisting of 18 investigators across 7 countries in the behavioral sciences, with a shared vision of answering meaningful research questions regarding addictive behaviors, predominantly substance use, that have important global policy, prevention, and/or treatment implications. He's also the founder and principal investigator of the Hispanic Addiction Research Team, HEART, founded in 2023, which is a collective of scientists, 12 researchers across 8 U.S. universities in the behavioral sciences, with a shared vision of answering meaningful research questions regarding addictive behaviors, predominantly substance use, and mental health that have important global policy, prevention, and/or treatment implications within the U.S. Hispanic Latinx community. He has over 135 peer-reviewed publications in academic journals, serves as an associate editor on 2 peer-reviewed academic journals, Mindfulness and Cannabis, and has several funded grants from the U.S. National Institutes of Health, Spanish Ministry of Science, Innovation and Universities, and the Argentina National Secretary of Science and Technology. Further, he is a current president of the Research Society on Marijuana, which he co-founded in 2016. So I'll now turn it over to Dr. Adrian Bravo. Thank you for joining us today, Adrian.
Thank you, Nicole, and thank you for that wonderful introduction. So here I'm going to share my screen for the presentation, just making sure we're good. That everyone see the screen? Okay, great. Thank you. First, I want to thank everyone for attending this webinar, and I was really excited for the gracious invitation to come present to this organization on the research that we've been doing in this topic area. Today, I'm mainly going to focus on that recent publication that Nicole alluded to, but also sprinkle in some of the new research that we've been conducting in this area. So as mentioned, the name of the talk is Changes in Mental Health Symptoms as a Predictor of Cannabis Coping Motives and Consequences, examining the impact of COVID-19 among college students. Before beginning my talk, just wanted to acknowledge some of my funding, both domestically and internationally. First, at William & Mary, with interdisciplinary research funds that has recently been helpful in more of my mindfulness research, but also just recently awarded one to look at cross-national impacts of politicization and healthcare access among young adults in Argentina and the U.S. Further, grateful for funding from the National Institute on Alcohol Abuse and Alcoholism, where I am a co-sponsor on a F31 grant for a PhD student looking at health disparities among Latino youth. I'm also appreciative of the funding from the National Center on Complementary Integrative Health, where me and my colleagues have a funded intervention development grant for developing a mindfulness-based intervention for combat wounded veterans, targeting a construct called moral injury. Internationally, I'm very grateful for having funding both in Argentina and Spain. Within Argentina, working with colleagues to look at harm reduction strategies for problematic substance use among Argentinian youth. And I'm also a co-director on a postdoctoral research fellowship looking at harm reduction among adolescents in Argentina. And then in Spain, also collaborating with colleagues in Spain, we have funding to do cannabis harm reduction research among community members within Spain, mainly young adults. And all of this funding has been supportive through my current research and some of the research that we'll talk about today. So briefly, just giving an overview of what I will be covering today. First, a little bit background literature, mainly focused on theoretical aspects of why we investigated this topic area and what really formulated the idea for the main study that I will be presenting on today. I think a lot of times, especially when you see the research being produced in an article, you just see the end product. But I think it's helpful to get a better understanding of the background that went into the design of a study, and particularly the reasons why we were particularly interested in the topic area and what we wanted to investigate. To that end, then I'll switch gears to the particular study that I will be presenting on today, that we recently published in the Journal of Cannabis. So I'll first talk about the aims of the study, dive into the study methodology and how we collected the data and how we planned to analyze that data. And then I'll talk a little bit about the results that we found and discussion of the findings and limitations and conclusions from that study. But then I'll leave you all with a little bit of a tease of the new lines of research that we're doing, where we're really expanding the work that we did within the US, but now looking at it globally across several countries. And I'll love to talk about more of that research at the end. So first, a little bit about the background literature and particularly why this topic area is important, particularly this idea that individuals may use substances for numerous types of reasons out there. Within the literature, as many of you are aware, people have different motivations for engaging in substance use, whether that's for social reasons, for either enhancement that they just like the feeling when they're intoxicated, or conformity, particularly among young adults when their friends or peers are encouraging them to use it. But the one that I focus on a lot in my research is what's called a negative regulation pathway. And this is where I really focus on the harm associated with individuals using substances as a primary coping response to deal with any of life's stressors. So as theorized within this pathway, really it refers to individuals using a drug to diminish negative affective states like anxiety or depression, or just for them dealing with the daily stressors that they engage in. So the idea behind this theoretical model is that as individuals feel sadness, depression, or more severe mental health struggles, they feel like they need something to help them alleviate of that suffering, at least momentarily. And for many, if they have ever engaged in substance use, might develop using that substance as a primary coping response to help deal or diminish the symptoms associated with their negative affect in that moment. And so here, with tying it to how we look at it empirically, negative affect regulations related to coping substance use motives, particularly this notion that individuals are, for the most part, able to kind of distinguish why they might want to use a substance for a particular reason. For many, it might be that they just want it to make them feel better. And this even applies to not only in clinical populations where you see that being a hallmarker for changing from just regular substance use to problematic addiction kind of related problematic use, but especially among young adults. A lot of them feel like they might help alleviate even daily kind of issues that they might engage in. And so they might view it as a proper way of dealing with the struggles that they might be dealing with in the moment. Here, I will allude to that this pathway has also been termed or coined in the literature in numerous other ways as well, regarding self-medication hypothesis or tension reduction hypothesis. So this is not new in any way with regards to how we've investigated this type of pathway. And really what's important is to understand is that individuals, all of us may engage in that motive at one time. The real concern, particularly from intervention kind of work, is that and prevention is that when do people start using it as their primary kind of coping response? And the issue is, and something I allude to college students and young adults who might engage in this motive, is that when you engage in it, it might make you feel better in the moment, but it doesn't actually resolve the underlying problem. Whether that is they want to drink to cope because they had a poor exam, Well, the next day you A, may be hungover, but B, the grade on your exam hasn't changed. So this is where a lot of researchers have tried to better understand, does this pathway have consistency across numerous types of negative affect, and does it apply to numerous populations? And my work has mainly been focused on young adults particularly. And so here, just kind of give you a figure that kind of represents this model. So again, it's the idea that as individuals are endorsing negative affect, whether that's depressive symptoms, anxiety symptoms, or stress, they might turn to using or become motivated to diminish that those symptoms or affect, and thus might turn to any type of substance to help alleviate that momentary or provide momentary relief. However, there's been a lot of research indicating that those type of motives leads to substance use problems. In the literature, and in a recent review in 2016, looking at the efficacy and evidence of different types of motives on drug use, coping motives has been the one most strongly linked to problematic substance use, regardless if it's looking at alcohol, cannabis, or other drugs. And this is even when accounting for typical consumption, frequency of consumption, and so forth. So for some reason, even when you account for individual differences in how much they're using a drug or how much, for example, in marijuana they're using, coping motives still have a strong relationship with problematic outcomes, whether among young adults, whether that's trouble in school, family, or social problems. But even as in adulthood, these things have been shown to have empirical support. And here, briefly, I'm just going to show you some of our prior work. And so in our prior work, before jumping to the study that I'll focus on today, we've done a lot of work looking at different aspects of this model. First, looking at, does it really help explain relationships between numerous types of negative affect and substance use problems? So for here in this example, me and my colleagues published a study looking at social anxiety as a predictor of both alcohol and marijuana use problems among individuals who endorse using both drugs in the last 30 days. And looking at this motivational model, we've not only looked at coping, but we've also looked at social enhancement and conformity motives to see what really helps explain the relationship between social anxiety and problematic substance use. And what we found consistently across both types of drugs was that individuals endorsing higher social anxiety were also reporting higher motivations to use either alcohol or cannabis as a coping response, which in turn was related to more problematic issues with each substance. So it seems like college students and young adults in particular, if they engage in both substances, are really open to using either alcohol or cannabis to help cope with any type of negative affect, in this case, social anxiety. Now, another question we have in looking at this pathway is, how good are we in differentiating the negative affect? In other words, is it that individuals just use substances to cope to deal with just feeling bad? Or are they actually able to differentiate what specific affect are they doing with? For example, is there a difference in people using alcohol to cope for depression versus anxiety and so forth? And so in this study that we did prior, we wanted to look this idea of, can young adults really differentiate between drinking to cope for depression symptoms or drinking to cope for anxiety symptoms? And really, is it that each of them are specific to those motives, or is it there's a global kind of motive of just coping that helps explain this relationship? Now, what we found in this particular paper was that global kind of composite score of coping helped explain the most variance in between depression and anxiety on outcomes. In fact, when breaking it down by drinking a cope for anxiety, drinking a cope for depression, both of them mediated both anxiety and depression, even if it wasn't tied to that specific affect. So really, at least from a more broad cross-sectional kind of approach, individuals just might, particularly young adults, just might want to engage in these substances to feel better. However, I do believe at the more granular level, particularly when you're asking individuals yesterday, why did you use a substance? They might be better at differentiating those kind of differences. And then finally, looking at this relationship, particularly among individuals who are now using these drugs simultaneously or at around the same time frame. I would say in the last 5 years, and maybe even 10 years, there's been a big push in the literature and from researchers and policymakers about this idea of co-use of alcohol and cannabis. In fact, in all the studies I've completed and done both domestically and internationally, it is really hard to find people who only use cannabis. In fact, in all our populations, including the international data I've done in various countries, including Uruguay, Argentina, Spain, Argentina, and Canada, and South Africa, and England, and US, a lot of individuals who, if they have ever done both alcohol and marijuana and then use it within the last 30 days, are using it simultaneously. So the question more recently is, well, why would they want to mix the drugs? In our research in this particular study, we wanted to look at whether negative affect, this negative regulation pathway, actually works similarly for each drug. Is it that a lot of students are engaging in using these substances for coping responses towards negative affect in order to, at least for their perception, momentarily relieve them of these symptoms and struggles that they're dealing with? Within this specific paper, we found support that yes, this negative regulation pathway still holds strongly, particularly in that when looking at stress, anxiety symptoms, and depressive symptoms, we did find that all three related to more problematic alcohol and marijuana use, particularly through coping motivations. And again, this was done among individuals who are using both substances majority of the time simultaneously within a single use session where they want those effects to overlap. So it seems like not only does coping motives have a big role to play in how people manage their symptoms of anxiety, depression, or stress, but it works similarly across drugs, at least in our research focused on young adults and alcohol and marijuana. We're seeing this kind of idea that this pathway is one that a lot of people are endorsing, and more importantly, unfortunately, it's leading to problematic outcomes for these individuals. So that has led us to where this particular study that I'll be presenting on today. Um, Obviously, we all have lived through the global pandemic of COVID-19. It has impacted a lot of different sectors within our society. And for me, and something that I always try to tell my students in my health psychology course, which is a mixture of public health and psychology and epidemiology principles, is really that this idea that COVID-19 didn't really create new issues within our systems, but what it really did was magnify existing issues. Similarly, as I mentioned, all these prior studies looking at this negative regulation pathway, we weren't revolutionizing this idea that people use substances to cope with various issues. Here, we wanted to look at, well, how does the impact of COVID-19, a new form of stressor, play a role in this relationship? And before continuing, I do want to give a huge shout out to my co-authors, but particularly the first author, Rebecca, who was an undergraduate student at the time when we started designing this study. And for me, in my research, I value a lot of getting information and understanding from people with lived experiences, whether that's in treatment or prevention work. But in here, and talking to an undergrad who started their college career pre-pandemic, during the pandemic, having to deal with being remote and then coming back to campus, what was their life looked like and what through their lens, how COVID-19 impacted them. And this is where Rebecca was really interested in this idea of how has changes in mental health symptoms due to the pandemic predict whether individuals are using cannabis for coping reasons, and if so, does that may lead to more problematic consequences for their cannabis use. And so here I'm going to present how the study was crafted, what was our aims and the design, and then the results from the study. But once again, wanted to give a huge shout out to Rebecca for really focusing on her population and why she was so interested in this line of work. So before jumping directly into our study, I'll give a little bit background literature, at least on the existing literature we have thus far of the impact on COVID on both mental health and cannabis use. So first with COVID-19 and mental health, this is where the literature has been fairly consistent in the findings, particularly that there has been an increase in mental health struggles due to COVID-19 among college students. In early work looking at it both immediately while we were still in the midst of the pandemic in fall 2020, even moving into spring 2021, we saw early reports that there was a clear increase in mental health struggles due to the pandemic among college students. And in fact, in one study, less than half of the students reported that they were able to cope effectively with the stress related to the pandemic. And this study was really helped guide the rationale of our present study. If individuals who all of us are dealing with the pandemic, fair enough in different ways, but it has a more objective impact globally, but every individual subjectively can deal and manage it differently. The idea that individuals might not feel like they have the adequate coping response, repertoire, resources may put them at higher risk for developing more mental health struggles and other issues, health issues, access to health care, and so forth. So when we saw this study and when Rebecca was doing this literature review, we were surprised at how many felt that they weren't able to cope with it, with the stress related to the pandemic, at least from this earlier research study. So in deciding on our study and how could COVID have impacted mental health, this really helped us delineate of how we wanted to examine that variable. We definitely wanted to account for the idea that whether people actually changed their mental health, or at least felt like their mental health symptoms had changed, due primarily to the stressors related to COVID-19. And I'll talk a little bit about that when we get to the measures section. So overall, it does look like COVID-19 has had some form of an impact on mental health among young adult college students. And again, that literature has been more consistent. What's been less consistent in the literature is its impact on cannabis use. In the fall of 2020, there were some national studies finding that there was roughly a 16% of individuals 19 years old had used cannabis to cope with COVID-19. And so this data comes from monitoring the future data, where they collect data from high school students and track them along as they continue to develop, and asking them specific questions about substance use behaviors and patterns. What was unique about this study is they really wanted to tie it strictly to COVID-19. And more importantly, how many of them are engaging in cannabis use in order to cope with COVID-19. Again, this was a nationally representative study. And in fall of 2020, they found that 16% of individuals who use cannabis indicated that they were using it to cope with the pandemic. However, when looking more at the actual rates of cannabis use and whether that has changed across among young adults because of the pandemic, this is where there's been a lot more mixed evidence. In one prior study by Shepis, which I'm a co-author on, we did find initial differences across cohorts as we got further and further away from the original stay-at-home orders of the pandemic in March 2020. And however, in other studies, like Gronsberger and Merrill, they found no changes in cannabis use. And in fact, in one study, they found less cannabis use. Now, this is where I think policy and the fact that these are young adults who are told to go home during this time period plays a huge role in this. And this has been what we've been seeing not only in the cannabis literature, but in the alcohol literature as well among young adults. A lot of individuals assume because of the COVID pandemic, there's going to be a flush or an increase of mental health struggles and stressors related to it. Thus, these individuals might turn to these substances to cope or just to deal with boredom or any other issues. However, when you're at home, that's a very different environment than being on college campuses or away from home or just general life in general. So while there might be an idea that they might be motivated to use cannabis to cope, access and resources, or at least availability of cannabis, might be a hindrance, particularly because a lot of individuals, at least college students, were sent home. So thus, this mixed evidence might not be surprising, particularly from a public health standpoint, because it really context plays a role and it really does matter in this relationship. And it might be that individuals were back home. What if they were home in a non-legal recreational state? Then they might have very limited access to cannabis and so forth. That being said, as I alluded to in the Patrick study, still a lot of individuals might still be motivated to use cannabis, even if they might not have the resources or access to the drug. Thus, that still plays a big factor in this idea of how individuals might manage and deal with their mental health struggles tied to the pandemic and stressors associated with it, and whether they engage in cannabis use. So that background literature really helped us design what the primary aims of the study were. First, a simple one was just, well, can we just compare college students who reported whether they had an increase, decrease, or whether they reported that their mental health stayed the same, here focused on anxiety and depression symptoms since COVID-19 orders. And does those individuals, whether they indicated there was an increase or decrease or remained the same, do they differ on cannabis coping motivations, their cannabis use frequency within the past month, and reported number of consequences associated with their cannabis use in the past 30 days? And then we wanted to examine, well, could the endorsement of using marijuana as a coping response be what links these self-reported changes in mental health to problematic cannabis use among this population? So really, it was first to identify, are there individuals that did report increases in mental health struggles due to the pandemic? After that, were there group differences among individuals who reported increase versus decrease or remained the same on cannabis outcomes? And then testing this mediation model where we're looking at, do these self-reported changes in mental health actually predict or associated with problematic cannabis use? And is that explained via endorsement of higher coping marijuana motives? So here I'll present a little bit about the research methodology that went into this study. And due to the methodology, there are limitations that we'll talk about later in the talk. So first, we had about 1,000, we recruited 1,318 college students from 2 universities in Virginia, one at Old Dominion University in Norfolk, and then the other being the College of William Mary, where I'm at. This was by design. William Mary is a really strong liberal arts academic small university with roughly 6,000, 7,000 undergrad, traditional kind of university where most of the population is 18 to 22. Whereas Old Dominion University is much more of a commuter school with a lot more older adults that are both working and going to school at the same time. So we wanted to have a much broader demographic than typically just focusing on one university. And importantly for the study methodology, we collected this data between fall 2020 and spring 2021. So we collected it in each semester of the university or that academic year at each university. Now, because not everyone uses cannabis and so forth, we limited our analytic sample based on certain criteria for our main model and testing the aims of our study. First, individuals had to have consumed cannabis at least one day in the previous month. The rationale for this is that it's hard to have motivations to use a drug if you've never used that drug or if you're not using it recently. The other reason is you really can't report cannabis-related problems if you're not also engaging in cannabis use. And thus, that's why we limited at least our analytic sample to those who have at least used cannabis at least one day in the previous month. And again, the data was started collecting in fall. So at the earliest when data collection began at September 2020, we were reporting on August, moving into September when most of the students were back on campus. Additionally, we needed them to answer questions about changes in mental health due to COVID-19. As you'll see in the methodology, in our models, we did control for past 2-week symptomology of depression and anxiety. However, we didn't want to use that data to estimate missing data because in my opinion, how you report, how you feel your own mental health symptoms have changed, whether that's backed up by the actual objective measures is still a very subjective kind of feeling. And so we really wanted only individuals who were able to answer that question for themselves. And then they also had to completed assessments on cannabis coping motives, cannabis use frequency, and consequences. And then finally reporting their gender as it was one of the covariates within our model. So in general, this really unfortunately limited our sample size to only 291 college students who again met all those prior criteria. Again, I'll talk about the limitations of the study, but we're doing more international work now to expand upon the work that we found here. As I really do see this work as more preliminary, moving into bigger kind of focus on the impact of long COVID on these constructs. But among the individuals who did qualify within our analytic sample, here, majority was either white non-Hispanic or Black African American. Majority were female. And now this is not as common with regards to the actual population of the cannabis users, but because we recruited mainly from psychology pools where females are overrepresented within these different departments, that's why you see that discrepancy. However, I will say that the rates of cannabis use between individuals who self-identify as male or female, that gap has closed a lot, and you see it in alcohol and other drugs as well. So it really isn't too far-fetched to see this high level of individuals, particularly female individuals, endorsing cannabis use. Overall, because particularly of William Mary, the mean age was a little bit younger than expected, but actually in most college student research, usually it's 18 to 19 is the average age. So you see it a little bit higher, mainly because of recruiting from a more commuter kind of school at Old Dominion University. And here, just giving you a breakdown of the different demographics within our participants, and I'll break down the marijuana rates of consumption and so forth, and once we get to the results section. So here, briefly discussing the measures that we alluded to, and I believe Nicole mentioned that this was recorded. And again, any questions, any resources that you need, feel free to email me, and I'll gladly provide any of this information. So the first question, and probably the most important one that we had a long time debating, was how do we assess self-reported changes in mental health due to COVID-19? Ideally, in a more objective manner, we would have collected data before the pandemic started, during the pandemic, and then years after the pandemic. However, many of us were caught off guard, honestly, both from public health prevention and intervention aspect from the impact COVID would have. And thus, we unfortunately don't have data knowing these individuals' mental health symptoms prior to the pandemic. That is why we decided to ask them straight up to themselves, to each participant, how would you rate changes in your mental health? So the way it was worded in the survey was, since the COVID-19 stay-at-home order went into effect in your state, has your general level of depression, anxiety, and then responses options included increased, decreased, or remained the same? In debating how we asked this question, one of the questions was, well, why don't we just say stay-at-home order? Well, because of how the pandemic impacted universities, particularly in March 2020, most universities shut down, everyone was sent home. Obviously, people all don't live in the same area, particularly out-of-state students and so forth, which could impact the impact of COVID-19 on mental health struggles, particularly based on the policy of each state, which differed, and the policy of each university that differed. So here, we didn't want to assume that every student at ODU or at William Mary lived in Virginia, and thus that's why we asked it in their state. And again, each participant had the option of saying increase, decrease, or remain the same, and they answered this question both for depression and anxiety. Additionally, and as I mentioned earlier, we did also assess past 2-week depressive and anxiety symptoms. Here, participants filled out the depression, anxiety, and stress scale. Here, they were asked about their 2-week symptomology in each of these subscales. However, for this study, we focused only on depression, anxiety, as we felt it was the most unique or most highly prevalent mental health disorders among young adult college students. And we also didn't want to add a stress variable when we were asking about stressors related to COVID-19 as well. But this is important because we use this data within our model to account for any change or any variability in cannabis problems due to past 2-week mental health. So really, even controlling for their current symptomology of mental health, did their self-report of whether there were changes in their mental health, according to them, based on COVID-19 stay-at-home orders and the impact of COVID, have a relationship with cannabis coping motives, cannabis use outcomes, and particularly problematic cannabis use. Now, looking at the cannabis outcomes, first we used the marijuana motives questionnaire short form, which assesses 5 distinct motives of cannabis: social, enhancement, conformity. A newer one that's different from alcohol called expansion, particularly in the mental high or the creativity side of using cannabis. And then, of course, coping motivation. So for this study, we've predominantly only used the coping motivation subscale of the marijuana motives questionnaire. Next, we did account for cannabis use frequency in our models. While we were mainly focused on problematic cannabis use, we also did want to run our models accounting for differences in frequency and or quantity within the participants. And so here again, the inclusion criteria was only using cannabis once in the last 30 days. So there's very big differences in someone using every day versus someone who's only done it once at a party or a social gathering. So in this, the way it works is participants are given a grid that is breaking down in 4-hour time blocks from Monday to Sunday, and then individuals within each time block indicate in a typical week of marijuana use, when do you use and how much do you use in each time period. And so what we do is we calculate both the quantity and frequency of how much they typically use cannabis in a typical week in the last 30 days. And then finally, our main outcome of interest was cannabis consequences. Again, my research has really focused on harm reduction. How do we reduce harm associated with these drugs, particularly if individuals decide to use the drugs? Okay, how can you use it safely? And so for us, we had students complete what's called the Brief Marijuana Consequences Questionnaire, which provides 21 distinct kind of issues that individuals may deal with due to their cannabis use. For example, things as feeling groggy in the morning, particularly for young adult college students, missing class or missing work requirements, and things that are particularly harmful, like driving under the influence and so forth. And so for us, we really wanted to look at the impact of self-report changes in mental health. Does that relate to each of these cannabis outcomes? And so here I want to show you the study results and what we found within the data. First, I just want to show you prevalence rates, or at least rates of endorsement across depression and anxiety. So first question was, did students endorse changes in their mental health due to the COVID-19 pandemic? And here, looking at changes in depression among our analytic sample, over half reported that there was an increase in depressive symptoms since COVID, which is obviously a very problematic number. That is really high prevalence of individuals who self-reported that they felt, compared to their normal average of how they view themselves, they did see an uptick in depressive symptoms, or at least in symptoms related to depression due to the COVID-19 stay-at-home orders and stressors tied to the COVID pandemic. About 38.5% reported that it remained the same, and only 8.3% reported a decrease, or that they felt like they haven't been dealing with these symptoms since the pandemic. So again, or at least the majority of college students in our specific study did report an increase in self-reported changes in depression due to COVID. Looking at anxiety, a little bit higher prevalence rate of individuals reporting an increase for anxiety. Here, about 59% of our sample. Now, this is important because I would say in the last 15 years, there's been a big shift among college student young adults. For a long time, depression was the highest endorsed and treated and diagnosed mental health struggle that young adult college students had. However, I would say in the last 15 years, anxiety has passed depression as the number one kind of problematic struggle or mental health struggle that young college students are being treated for or acknowledging that they're struggling with. And so this data kind of aligns with that research as well. So here again, 59% reported an increase, about a third reported that it remained the same, and again, very minimal amounts of individuals reported a decrease. So overall, in looking at our first aim, at least via self-report, individuals did, at least a majority of these college students did report an increase in both depressive and anxiety symptoms, which is obviously a big issue to address when looking at what predicts problematic substance use potentially. So here I want to show you the results of looking at group differences based on those rates on these marijuana outcomes. Now, given that there was such a small prevalence of individuals that indicated that they found that their mental health struggles decreased due to COVID-19 orders, here I'm only going to report on the two larger sample sizes. So really, and in the rest of the results and in the model we tested, we really wanted to compare individuals who reported an increase versus those who indicated that their mental health remained the same even after the COVID-19 stay-at-home orders. So here I'm going to show you a table that indicates just mean differences on each of the marijuana outcomes, broken across how people endorse changes in depressive symptoms and how they endorse changes in anxiety symptoms. So here, as you can see, and I've bolded the significant results or mean differences across individuals who report that their depressive symptoms remain the same versus those that increase. As you can see here visually, for those who indicated that their depressive symptoms increase due to COVID-19, they endorse a higher mean of using cannabis for coping motivations. They did not statistically differently, but you can see a higher rate of use frequency in a typical week. Here, think of this as use sessions. But importantly, in the research and why we wanted to do this study, they did also report more cannabis consequences compared to individuals who indicated that their depressive symptoms remained the same. Interestingly enough, looking at anxiety symptoms, we only really found significant difference with regards to the mental health change on cannabis coping motives. While the difference across problems wasn't too far off, at least statistically, and actually you can see the frequency was actually even higher a little bit within those who remained the same. So here, one thing to acknowledge here is that while seems like might be a slight increase in use and consequences for those who reported an increase, it's really that they also endorse using cannabis for coping motivation, where you saw the biggest difference between these two groups. And that's a lot what this research wanted to hone in on, this idea that young adults, when dealing with stressors, in this case, changes in their mental health due to COVID-19, they might be wanting to use something to help them in the moment to deal with these increases in depressive symptoms and anxiety symptoms. In this case, they might be motivated to use cannabis. And again, this is among a group of young adults, college students who used cannabis in the past month. So beyond just showing you the results and the group differences on these outcomes, here we wanted to test the mediation model, looking at are there differences between individuals who endorse increases in poor mental health versus remain the same? Did that relate to more problematic outcomes via higher coping motivations? And here you can see how this model played out for both change in depressive symptoms and change in anxiety symptoms. Here, an endorsement of an increase of a change in depressive symptoms and anxiety symptoms was associated with higher coping motivations. Here, the effects presented are standardized effects, which can be really interpreted in standard deviation differences across people. So individuals, particularly that endorse increased depressive symptoms or increased anxiety symptoms, did report higher coping motivations compared to those who remained the same. Importantly, that relationship also, we found a relationship where individuals who were reporting higher coping motivations were also reporting higher cannabis consequences. So taken together, individuals compared to those who indicated that their mental health remained the same, individuals reporting higher increases in depression, anxiety symptoms did also report higher coping motivations for marijuana to deal with that affect, which in turn was associated with more problematic cannabis use within the past 30 days. And again, in these models that I'm presenting, we did control for how frequently they use cannabis, their gender, and their past 2 week symptoms of depression and anxiety. So it really does speak to this idea that individuals, when they're particularly knowledgeable or understanding that there is a change in who they are, particularly tied to their mental health, they want to deal with it. They want to fix it. They want to help themselves and alleviate that suffering, which all of us would want to. The problem is they're using a drug that A, isn't solving their mental health struggle, and more importantly, may also produce other problems, in this case, more cannabis use issues down the road with their use. Now, what does this all mean, and where are we moving forward with this? So again, here briefly summarizing our findings, majority of participants reported an increase in anxiety and depression symptoms compared to remaining the same or decreases due to COVID-19. Among those individuals reporting an increase in these symptoms, they are reporting higher cannabis coping motives, and for those particularly who identified as increase in depression, also reported more negative consequences, again, focusing just on group mean differences. What we found in our mediation model is that those who reported an increase, again, compared to those who endorsed remaining the same of their mental health struggles, reported more cannabis consequences via higher endorsement of cannabis coping motivations. So again, it really is finding support, more empirical support for that negative regulation pathway, which again, a long history of that being well supported, but here now we're tying it into a global pandemic and how that's impacted mental health, and particularly individuals' choice or use of drugs to help alleviate the suffering that might be associated or be a cause of the pandemic. Now, as in all research, there are limitations, and those do place a hindrance on how much conclusions we can make from this broad study. First, all the data was collected was self-reported and cross-sectional. So the cross-sectional part being the most important part. As much as I tried in this presentation, I wasn't trying to be as causal in my language about what we found. Here, what we found were relationships between self-report changes in mental health, cannabis coping motivations in the prior month, and cannabis outcomes in the past month. But again, we can't make causal inferences within our research. The other important aspect is we only examined a few factors may have influenced relationship between COVID-19 mental health and cannabis use outcomes. There are numerous aspects, and some that aren't even just an individual factor. Context, particularly where they were at home when the pandemic was happening. What was their access and availability to cannabis? What were state and legal policies related to cannabis in each state? I think one of the big discussions early on in the pandemic was what is an essential business and what is not. And states were having to decide, are drug stores, particularly here in Virginia, where we have privatized alcohol sales, where you can only buy liquor at what's called an ABC store, is that an essential business for individuals who might have an alcohol use disorder? In more other states that had recreational marijuana, they also had to decide, is marijuana consumption is an essential business during the pandemic? In some states, they did allow these dispensaries to stay open. So again, all of that plays a role in the relationships within we just discussed in this one study. The other aspect is that research should explore how COVID-19 has impacted mental health and drug use among vulnerable student populations as well as clinical populations. So here, it was a broad group of predominantly young adult college students only at 2 universities. So we're limited and we're really focusing on the context of Virginia. And more importantly, we didn't have a sample size that was adequate to go look at the differences of the impact of changes in mental health due to COVID-19 on cannabis outcomes by different demographics, whether those are individuals of different races or ethnicity, gender, sexual orientation, and so forth. So future work really needs to look at health disparities within these relationships. And that actually leads me to my near final point in the current research that we're doing to expand on what we found in that study. I myself was born in Santiago de Cuba, Cuba, and I immigrated to the States when I was young. So I was always looking at substance use very differently than what particularly American college students were. I remember coming to college, my first frat party, and they were like, "We're gonna get blackout drunk," and I'm like, "Why? I don't understand why that's the goal." And so for me, I've always done a lot of cross-cultural research and understanding not only substance use and mental health, but what are factors that predict problematic substance use in various due to culture or cultural reasons or national policies. So why even need it for this particular topic? Well, for one, COVID-19 impacted the entire world. It is very rare for us to actually have a health crisis that impacts the globe, the entire world. There's obviously a lot of issues with different viruses and things popping up in certain regions of the world and so forth. But to be able to actually look at something that has impacted everyone is a very timely aspect for us to engage in better science in order to allow us to do better prevention work like this group does, or intervention work as well. So naturally, we need more cross-cultural, cross-national research because the main predictor, COVID, impacted everyone. Additionally, and this is where I sometimes chuckle when I tell people I'm an international researcher that does mental health and substance use, and they're always asking me like, well, why? Why look at other countries? And I say, I'm sorry, I didn't realize the US was the only one who has struggles with addiction and mental health problems among their population. So unfortunately, there is a big issue about poor mental health and problematic substance use globally, and particularly among young adults, whether they're in college or not. These rates are too high in many countries, including the US, but also globally. And so we need better research, not only here, but everywhere to better understand what is going on. And particularly what leads to the final point I'm making is, are these pathways, this negative affect regulation pathway, or these theoretical models that have found a lot of great support, are they universal or culturally specific? Vast majority of research, mainly due to the interest and the resources and the value of science, has come out of North America or more Western European countries. Does the models that we're talking about actually relate to, or at least help explain variability among Argentinian college students in South Africa, and so forth? So while yes, we can focus on domestically issues and working on ways that using science to help create prevention coalitions and work, we also have to do it globally. And this is why I was very appreciative to come and speak to you all because of the international scope of this organization. So this is where I'll briefly talk about the new study that we're doing with my international team. But first, I'll briefly talk about the international team. I created what's called the Cross-Cultural Addiction Study Team in 2016, which, as during my intro was alluded to, really is a collective of international science with a shared vision of answering meaningful research questions regarding addictive behaviors, mainly substance use, though more lately we've gone into social media addiction, gambling addiction, and video game addiction, that has important global policy prevention and treatment implications. So briefly, this is the entire team currently. So I collaborate with colleagues within the U.S. across numerous states, in New York, New Mexico, Colorado, and Virginia, and then globally collecting data in Spain, Canada, England, South Africa, New Zealand, and Argentina. And the best thing I can say about this team is not everyone is an addiction researcher. In fact, my colleague Deborah Kaminer in South Africa is a world-renowned childhood trauma researcher. But all of these factors, if we are trying to better understand global mental health, global addiction rates, we need to understand expertise in an interdisciplinary work and work with colleagues who have different expertise and understanding of what is happening within their own cultures, and helping us understand whether these models, like the one that I alluded to today, is actually universal or culturally different. So here, the current study that I'm going to show you some very preliminary data is called the Cross-Cultural Longitudinal Assessment of Stuff study. As you can tell, I'm not the most creative of individuals, but in this study, we really wanted to replicate not only across countries, but longitudinally these models predicting problematic substance use and mental health among young adults in multiple countries. So for this data, we've collected data in Argentina, England, Spain, South Africa, Canada, and the US. And what was unique to this study, beyond just looking at typical predictors of problematic mental health and substance use, we wanted to collect data on COVID-19, which actually was not the first intention of the study. When we were designing the study, me and my colleagues were talking about COVID and like, do you think we should collect data about COVID? Like, do you think it'll still be around? And we were designing the study in early January 2020, February 2020, thinking that it might just be like a few months and it will be good. But luckily, we did collect a lot of COVID-19 data within this data set. So in this data set, we have data on vaccination, infection, whether individuals were hospitalized due to their COVID-19 infection, whether they had family members that passed away due to COVID-19. And so here we collected this data, roughly about 4,500 young adults across these countries to really look at the impact of COVID-19. Additionally, we also looked at a measure of COVID-related stress. So how much do stressors tied to the pandemic really are endorsed, even years out after the pandemic? So this study, data collection actually started in late 2021, and we collected longitudinal data up to 2023. And so we're in the midst of cleaning that data, but here I wanted to present to you some preliminary results from this longitudinal data set across these countries. Here, tied to the model I just presented, this idea that there are changes in mental health due to COVID-19, does that relate to more cannabis coping motives, and thus does that relate to problematic cannabis use? Here you can see the models. Now, what's different about this model is I added COVID-19 stress. So here, really expanding upon the prior study where we looked at self-report data of whether there were changes, but really looking at over time, did individuals report changes in their mental health, and does that relate to cannabis use? So what we found, and again, this is very preliminary data. This was data only among the US sample. We're still cleaning the data in Spain to bring it all together. But so here's just US data longitudinally looking at the impact of COVID on marijuana consequences over time. Here, what we did find and support was that individuals reporting higher COVID-19 related stress, even we're talking about stress in 2022, when the baseline for most within the US really started, individuals reporting higher COVID-19 related stress did report more depressive symptoms and anxiety symptoms, which in turn was related to higher coping motivations for cannabis, which again was in turn related to more marijuana consequences. And once again, we controlled for gender and current cannabis use frequency and quantity behaviors. Again, very preliminary. More importantly, though, this gives us a background into what else can we do with this data. I'm very excited to look at particularly public health, policy, country differences in these relationships. As we understood, every country had a very different approach in handling the pandemic, what kind of orders, stay-at-home orders, policy really did change. Particularly here in the US, most states were locked down for roughly 6 months. In Argentina, they were locked down for like a year and a half. In England, while they were locked down, they literally had policemen patrolling the outskirts of city limits or town and villages so that if you're driving past the county line, they would literally stop you and ask you where you're going. Here in the US, that wasn't the case. So what we're really excited to look at is not only the longitudinal impact of COVID-19 on cannabis and alcohol, and in this data set, we're also looking at psychedelics, e-cigarette use, vaping, and other substance use measures, but also looking at the impact on mental health and so forth. So overall, in the conclusions from the research from particularly the main article that I presented today, and even some of the newer lines of research and data that's coming out from our longitudinal international data, really the take-home message is that individuals are struggling from COVID-19. And even, and as shown in the Project Class data, years later, people are still struggling with it, particularly from all the impact that COVID-19, not just on our health, but our financial health, social aspects. As many of you are aware, the general report on isolation being a big, and loneliness being a big health crisis right now. All of these could impact this idea of how people deal with the pandemic, but more importantly, how do they cope with it? And unfortunately, from this research, it seems like individuals who are already using marijuana might turn to cannabis as a way to cope with these increases in poor mental health struggles. Unfortunately, however, that doesn't deal or fix long-term their mental health struggles or the pandemic that case, but it might be also associated with more problematic cannabis use. And how does that develop long-term? Overall, and particularly for organizations like this group, really my take-home message is that we really have to think more critically, particularly from prevention aspects and how we help hopefully prevent problematic outcomes related to people's substance use, or even the uptake of engaging in cannabis and as the first time for a drug. providing resources for substance-free coping strategies to manage mental health impact of COVID-19 may be extremely useful. And now, and this applies to numerous populations, while I have today focused on young adults, I could see this play out a lot with older adults. As part of and president of the Research Society of Marijuana, particularly as older adults are beginning to use cannabis more often for medicinal reasons and so forth, how is that being impacted among older adults and how they're viewing cannabis as a way to deal with the issues related to the pandemic as well, not just young adults and so forth. And these are all lines of research that are important, particularly in trying to better understand prevention and intervention efforts among individuals post-pandemic. And with that, I appreciate your time and thank you. These are beautiful images from my university. And of course, I would answer any questions now, but if you need any questions or questions about the research, the larger study that we're doing, feel free to email me. Thank you.
Fantastic work. Thank you, Adrian, for sharing and breaking everything down for us. So can you see my screen?
I can, thank you.
Okay. So we'll start the Q&A session. I'll start and then we'll hear from our participants. So please continue to type your questions in the Q&A box on the bottom of your screen. My first question is, did you collect data to determine if the student participants lived on campus or at home during the COVID-19 stay-at-home order?
So that's a great question. And that's one reason why Rebecca was very helpful in designing this study. Because when we were collecting the data in the fall of 2020, the question was, well, how has the pandemic impacted each individual? Well, the problem was, at least in most universities, and particularly at ours, at William Mary and at ODU, around March 2020, which was spring break for most of us, they were told never to come back. So people literally at William Mary weren't even allowed to come to their dorms to pick up their stuff. And that was kind of the precedent that was set. So when we were designing the study and knowing that we were wanting to start data collection in August, early September, the question was, how do we want to assess the fact that they probably weren't on campus anyways? Because during a summer, most of them, at least both at William Mary and ODU, they're sent home or not on campus for the summer anyways. So that's why we wanted to be a little bit vague on where or whether they lived on campus or at home. We didn't ask that specific question, but we did ask what states they live in. And so we were able to collect data and account for date or look at differences among individuals who endorsed that they were out of state, outside Virginia versus in state and Virginia. However, we didn't look at it within the specific study that I presented on, only because of the small sample sizes. There weren't too many people out of state. But that alludes to this idea of context playing a big role, and why particularly I'm excited for the longitudinal cross-national data where we did ask where during the pandemic were you housed in, or where were you doing during the stay-at-home order? Was it at home or was it somewhere else?
Yeah, definitely. And my second question, you already talked about, but if you have anything to add, you mentioned that future research should explore these measures among vulnerable student populations. Do you have any plans to continue this research?
Yes, definitely. One of the things that I'm particularly interested in, both within the US and cross-nationally, in that data for Project Class, we asked about social deprivation theory. My colleague Lee Hogarth in England really is big on this idea of the reason that individuals, what might differentiate from some of us who use substances for fun versus those that might end up, unfortunately, developing a substance use disorder, is this idea of social deprivation. That, as I concluded, we need to provide more resources that are substance-free. Many people might not have access to those things due to either their means, their lack of finances, the resources provided to them, and so forth. For me personally, who grew up very low income on food stamps and things, if the pandemic happened during college, for me, my parents didn't have internet at their house. They couldn't afford it. So I would have had to handle college very differently than someone who might have had differing means or resources and so forth. And this also applies to individuals who might have a lot of family members who we can't somehow distance when there's so many people living in the same home and stuff. And then, of course, looking at other resources among individuals who have minoritized identities. Already there's a lack of resources or social support for those individuals. How much lonelier did they feel? How much away feel like any support that they did have was no longer in existence could play a big role in the impact that the pandemic has had, both on mental health and their substance use behaviors.
Mhm. And my final question, how can coalition members and substance use preventionists in the field best use the findings from your research?
Yeah, so I think for me, it's really not expanding. Again, I alluded to COVID-19 didn't create new problems, it magnified existing ones. And I think that's what our found today. in the sense that many people, not even just young adults, who engage in substances do feel like in the moment that they can feel better. And that may be true for the short hour or two during that period, but as I alluded to, it doesn't solve the long-term struggle. So the reason why they're drinking or using cannabis still hasn't been resolved. They're just coping and using the drug to deal with it in the moment, or at least suppress it, not think about it. The problem is those long-term issues still may exist. And so this is where perhaps, again, alluding to what can we do to provide both at the individual level ways to engage in more substance-free activities, other coping responses, ways to manage stress and other things. But at a more systematic, more public health approach, are we providing resources outside of those things? Are we allowing for greater access to these things? For example, more telehealth or other aspects. And it goes back to these public health kind of questions I alluded to during the pandemic. Are drugstores essential businesses? Are these things are become really critical as we progress? There's a lot of research, particularly in looking at people who do virology and kind of research. They're arguing that it's not a matter of what if there's going to be another pandemic or epidemic. It's a matter of when. Thus, are we going to be both from a prevention, intervention, public health, epidemiological approach, and individual care? Are we ready for it? And I think this kind of studies that are coming out only going to keep impacting us, especially as we look at the impact of long COVID on these things. Does that play a role? And in fact, and I didn't mention this, but in international data, we did collect data, self-report data on immune functioning, colds, viruses, fevers, other things that from a physical health standpoint could also be impacted not only by their substance use, but also the pandemic and infection and things like that.
Wow, so interesting.
Thank you.
So we'll move on to participant questions. I did see a couple already in the Q&A box. So if you could relate to us again, what was the definition of depression and anxiety for this study?
Yeah, very good question. So that was another question we had when we asked about changes in self-report and depression or anxiety. Did we want to list out all types of symptoms that are at least indicated in the DSM-5, which is how we diagnose individuals with major depressive disorder or general anxiety disorder, or did we want them to self-report based on their conceptualization of it? Again, talking to Rebecca, a college student who was 20 at the time, she was like, I don't think any of us really know all the symptoms, but we understand broadly what those terms are, and we understand when we're not feeling the same way. And so she on purposely wanted to leave it vague. However, in the 2-week past symptomology of depression and anxiety, they're reporting on symptoms that are tied to the DSM-5 and whether you experience any of these in the last 30 or last 2 weeks. So for example, for depression, anhedonia, loss of pleasure, not wanting to get out of bed, things like that. And then for anxiety, similarly looking at symptoms that control for it.
And if you could just give us a little bit of an overview, what did you define as negative consequences or problems?
No, that's a great question. So in the measure that we use, they break it down across distinct kind of domains. So one being addiction related, so things like withdrawal and cravings related to cannabis, but particularly withdrawals being a consequence, but more social, cultural, or social, psychosocial kind of consequences. When I teach this to students, they're always surprised that when we diagnose individuals with substance use disorders, the quantity isn't in the diagnoses. It's more using than you intend to, not being able to control it. So some of the questions get back to control, impaired control, but also is it impacting your psychosocial functioning, which is also symptomology used for diagnosing individuals with substance use disorder. Is it impacting your schoolwork? Is it impacting your relationships and so forth? And the more severe, harmful ones of did you engage in driving under the influence? Did you engage in physical confrontation and things like that as well? So in what we did is we summed up the number of endorsed problems in the last month to get a total score for each individual.
Okay. All right, well, we'll just conclude our presentation. A few reminders here. So please take a couple of minutes to complete an evaluation for this webinar. You can scan this QR code with your smartphone's camera or access it through the link in the chat box. If you complete the evaluation, you can receive a letter of participation. You can download it from the thank you page at the end of the survey. You must fill it out to get the letter and you must download it right away because you will not be able to access that page later. I will also send a follow-up email to all attendees with this week with a link to the presentation recording and the evaluation. So you'll be able to do it that way as well. And please mark your calendars for the next Research into Action webinar scheduled for Tuesday, July 9th at 1:30 p.m. Eastern Standard Time. Will feature a similar research article on tobacco and cannabis use and mental health in adults. And this year's annual survey of coalitions is closing on June 30th. So if you have not completed it, please email survey@cadca.org as soon as possible to receive your coalition's personalized survey link. The information you provide will play a critical role in shaping future strategies. We use the collective data for advocacy work on the Hill and to further develop and fine-tune our coalition research. Also, if your state reaches a submission threshold, your state prevention coordinator will get a formal report of your collective data so that you can use it in your coalition efforts. So please get that done by June 30th. Thank you, Adrian, for your presentation. I've included your email here as well as your X account, formerly known as Twitter, information there. So if anyone wants to follow up and contact you, they'll be able to there. And if anyone in our audience has evaluation or research related questions, you can reach out to us at evaluation@cadca.org. Thank you for your participation and support, and please remember to complete the evaluation, and we'll see you next time. Thank you.